This CD-ROM program is designed to be used in conjunction with the 8th edition of the W.B. Saunders textbook, The Medical Assistant, Administrative and Clinical by Kinnan Woods, with its accompanying Student Mastery Manual. Through the use of case studies, the program allows the learner to practice the application of information provided in the textbook and to use problem-solving, decision-making, and critical thinking skills. In addition, for specific administrative and clinical competencies, the learner's ability to use critical thinking and priority-setting skills during a clinical or administrative procedure can be challenged. Appendix C of the Student Mastery Manual contains materials used throughout the program. Mrs. Soto and her 4.5-month-old daughter, Robin, missed an appointment 2 weeks ago for well baby care. They have now returned for that well baby care visit. Mrs. Soto is concerned that the baby may have an ear infection because she has been restless lately. Her older brother has a history of ear infections. Mrs. Soto also ran out of vitamins a week ago and has not had time to replace them. Click Next to move on. Prioritize the actions you would take by dragging them into the correct order. Click Next when you are done. Your incorrect responses have dropped out. Click any tile to obtain information about it. Click Next to see the experts' choices compared to yours. These are our experts' choices and your choices. Click any tile to receive information about it. Click Finished to move on. This 4.5-month-old baby girl's weight is 14 pounds. Plot her weight on the growth chart by clicking on the intersection of the lines representing weight. If you make a mistake, re-click with your new choice. Click Next when you are done. Your plot points are good. Click Finished to move on to the next challenge. This 4.5-month-old baby girl's length is 24.5 inches. Plot her length on the growth chart by clicking on the intersection of the lines representing length. If you make a mistake, re-click with your new choice. Click Next when you are done. Your plot points are good. Click Finished to move on to the next challenge. The weight is 14 pounds. The baby's age is 4.5 months. On the bottom of the chart, identify 4.5 months and track this line up the chart. In the left-hand column, identify the weight of 14 pounds and track this line horizontally until it meets the 4.5-month vertical age line. This is your plot point for the baby's weight. Similarly, for the baby's length. Carry on up the age plot line. In the left-hand column, identify the length of 24.5 inches and track this line horizontally until it meets the 4.5-month vertical age line. This is your plot point for the baby's length. This baby's length and weight are both in the 50th percentile. This means that in every 100 babies, 50 will score below this length and weight. Click Finished to move on. After examining the baby, Dr. Hughes asks you to give the baby her immunizations of DTaP, oral polio, and HIB. By dragging the tiles, arrange the immunizations in the order in which you would give them. Click Next when you are done. Compare your sequence with that of our experts. Click Next to move on. Both DTaP and HIB immunizations are given intramuscularly. Use your pointer to inject the immunization into the correct site on the baby. Re-click if you wish to choose a different site location. Click Next when you are done. The vastus lateralis muscle on the outermost side of the thigh is one of the body's largest muscles. It is comparatively well developed at birth, unlike the gluteus maximus muscle, which is not developed enough until the child begins to walk. The vastus lateralis muscle is preferred over the deltoid muscle as it is the safest place for intramuscular injections in infants and babies. Click Finished to move on. Both DTaP and HIB immunizations are given intramuscularly. Identify the correct syringe. Click Next to continue. Both DTaP and HIB immunizations are given intramuscularly. Identify the correct needle length and gauge. Click Next to continue. Both DTaP and HIB immunizations are given intramuscularly. Identify the correct angle. Click Next to continue. Click Finished to carry on with the administrative management of Mrs. Soto and her daughter Robin.